Good afternoon and welcome to another very interactive session from MGM Healthcare. I'm Dr. Shreevidya Venkatraman, Senior Physician, Internal Medicine. With me, I have Dr. Swamikannu, who is our Clinical Lead Internal Medicine. Sir has been our mentor and a dynamic physician for the last 34 years, a Stanley Medical College alumnus with multifaceted experiences. I don't have to say anything new for Sir at all. Good morning, good afternoon, sir.
Good afternoon.
Yeah. So we are here today to discuss the various aspects of the new milestone which we are going to enter, and that is COVID vaccine be open to public. So, what has been your experience with COVID vaccine so far, sir?
So far, my experience with the vaccine looks very good and interesting too, because people have different opinions about vaccines that are available with us now. Basically, we have two vaccines available currently. One is called Covishield, which is from the Oxford University and AstraZeneca product, and it is a new form of vaccine which is developed against the spike proteins of the virus, which is when injected into someone's body, the body will produce antibodies and protect us from the dreadful COVID infections. The second vaccine that is available is Covaxin, which is developed by Bharat Biotech and in collaboration with ICMR. So the second vaccine is a conventional vaccine where the virus is inactivated and injected in the body, which is similar to any other vaccine currently available in the market. So we have two vaccines, and it's going to be a protective one for all of us, and probably it's going to be getting us out of this pandemic situation.
So the idea here is that we need to understand that vaccines are pretty much the same or similar type of vaccines we have used in the past for various viral diseases like mumps, measles, chickenpox, hepatitis B, hepatitis A, the other routine vaccines which have been recommended in our expanded program of immunization by the government of India. The issue here is most of the time, sir, if you will also agree with me, that the minute we talk about vaccine, it stops with the pediatric age group. The issues which we are facing right now is that people do not even conceptualize the idea of adult immunization. So for those who do not know much about vaccination in general, sir, so what do we tell them, that how do we go about it?
Vaccination is basically, you have adult vaccination and pediatric vaccination, and both are for protecting us from dreadful diseases. If you remember, smallpox was eradicated because we had an effective vaccine which was used, and then we came out of the smallpox. The next vaccine is a flu, which was, if you recall, 1919, the first pandemic occurred, from which we have come out of it after the vaccination. So, like this, we have a vaccine for now, corona, and probably we will come out of it once we start using vaccine. So, vaccine is basically an umbrella. Is given to you when the rain is heavy. So it is going to protect us, if not 100%, it may be protect less than 100%, but it is going to save us from the pandemic situation.
Yeah.
So vaccine is a must. There are some exceptions that you can always decide with your family physician. And if you have any queries in there, as we go along, we'll clear all your doubts about vaccinations. She'll be asking, I'm sure she's going to ask any questions.
Because the protocol which we have been given by the government of India and the type of work which has taken up by government of India in the middle of a pandemic has been amazing actually. we are actually liaising with different government bodies, and each of them have very crisp, specific answers, and problems are being solved at the run as it is emerging. So there are going to be rules. So I have been asked multiple times that why was the vaccination started for healthcare workers, and it turns out that the healthcare workers themselves are not have not all of them have come forward and taken the vaccine. So the vaccination numbers for healthcare workers has not reached the pinnacle or the level which it should have reached.
It is the healthcare workers also know they are part of the society. When the society reacts in a similar manner, the healthcare workers also belong to the same society. So there will be apprehensions whenever a new vaccine is introduced. This is the case with all the vaccinations. When there are group of people who oppose always the vaccination. There are people who are for vaccination all the time. So there will be different reactions when a new vaccine is released. So I think it is a duty of the healthcare workers to understand the basics of vaccination. Vaccination is not to try to come out of this dreadful situation. 150,000 people have died of corona. So you don't want any more mortalities added to our list. So the healthcare workers initially there was hesitation. Now I think people are getting vaccinated slowly. Uh, we should be the example for motivating those people now to get vaccinated
Absolutely.
and clear all their doubts if they have any.
And we have not faced any big side effects or adverse reaction in the last 4 weeks of vaccinating our own employees and load doctors. So
I haven't come across any serious reactions with the vaccine so far, though we are 4 weeks into the vaccination program now. I had the first dose and the second dose I completed. Um, with all vaccinations, there will be minimal reactions which are expected, which is normal. Actually, 10% of the people can have they can have a pain at the site of injection. They can faint at sometimes because of the pain, what is called a pain syncope. Then there can be a reaction here and swelling here in the injected site. They may have a little bit of fever in the same day or next day, and they can also muscle pain, what is called myalgia. And these are all normal reactions that you get with the vaccination. This is applicable to any vaccine. And the same note, there can also be no reaction to vaccine. So it doesn't mean the vaccine is
it's not
not
going to
working.
work. Yeah,
It does work even if you don't get fever, myalgia, and body pain, fever. Even if you don't get it, the vaccine is going to work.
Yeah. Yes. So at this juncture, I'm going to tell you that we are having, we are speaking, as we are talking to you, the government of India and the local public health personnels are sitting and setting up protocol for opening up the portals for COVID registrations. So there is going to be two type of registration. One, you can go into the Arogya Setu app, and there is COVID slot there, and you can go there, put your details and all those things. And I think they are also going to release a separate COVID portal also. You can also register with your local hospitals. Like we have our own registry. We register our patients, or all those who believe in us. Please come forward. At the end of this talk, we will give you the link for it. Please go ahead and register on that. Once the COVID portal opens, we will try to register as many of that who can be registered. It can be multiple registration, but you will only receive one shot. So, which is fine. The idea is that you need to go. There is also one possibility which they are trying to do for people who are geriatrics, who are not very well versed with digital Android systems and with mobiles and phones and don't know how to,
No
that they
access to
can,
internet.
no access for internet and all that, they can probably go to the nearby corporation or hospital, register with the help of the personnel over there and take the shot directly. I am sure these things will be clarified in the next 24 hours, because we are scheduled to open up the COVID portal and the first shot of vaccine for the public from the 1st March. Right. So as we go on, sir, why is the vaccine mandatory for everyone, even for people who are not yet affected by COVID-19?
You know, when Corona came into our life, so we all were worried how we are going to survive this situation. Now, vaccine is the only solution to come out of this situation. Once you get vaccinated, you are protected against corona infection. If not 100%, it is going to be 90 to 100%. Even if you consider 60% effectiveness, you are going to be protected by the vaccine. And not only that, you know, even if you get a corona after vaccination, the disease is not going to be severe. And தமிழ்ல ஒரு பழமொழி இருக்கு, தலைக்கு வந்தது தலைப்பாக போகும். அதே மாதிரி when when you get vaccinated, if not 100%, you will be certainly not getting severe disease with the vaccine. So it is a mandatory for everybody gets into the vaccine unless there is a specific contraindication.
We have seen this with chickenpox vaccine also, because those who have not had chickenpox as children should go ahead and vaccinate as adult, because adult chickenpox is dangerous. So the same with vaccine. COVID vaccine is not going to stop the transmission. It is going to prevent the severity, it's going to bring down the severity of the sickness. One very interesting article came out today, sir, saying that those who have been vaccinated, first 3 months after the last shot, they don't have to quarantine themselves.
If they're accidentally if they're
Exposed, they
yeah,
don't have to
that's right.
quarantine
I
themselves.
think we need more information
About that,
for
yeah,
this.
because we are still very
we haven't
naive.
vaccinated the entire population. So
Yeah,
once
yeah.
we get vaccinated, then more informations will be available. It's very premature to conclude that
Correct.
that point.
Yes. Also, that individual response to the vaccine we will only know as the time goes. So it will still make sense that you need to take the vaccine, but you need to continue wearing the masks. So yes.
One of the best example that we can think of from the past is BCG vaccination. The moment that the BCG vaccination has been there for last 40 years, the kind of diseases that we used to see in the past, like you know the damaged lung cavity in pulmonary tuberculosis, we don't see that kind of severe diseases nowadays, because it is probably because we have vaccinated them for last 40 years.
Absolutely.
Nowadays, the child, as soon as it's born, the first day itself BCG vaccination is given. That has gone a long way to protect severe forms of disease. Like meningitis, we used to see a lot in those days. Now we don't see
those,
that amount of meningitis nowadays. So vaccine will protect in the long run.
Absolutely. So, how effective are these vaccines against the new corona variants? Now we have got two variants coming up, one from the UK, one from the Brazil. Um, do we? I mean, the tension is, or the doubt is, that we vaccinated ourselves today, and we come across a spread which is a different variant.
It is again, it is not a new thinking or thought. People always have, when the new variant comes, what happens. So this has happened with even dengue virus. If you see, you know, there are 4 different species in dengue virus. So when we initially had dengue, we thought there is only one. Now there are 4 variants of dengue species. Similar thing will emerge in future, but the vaccine is going to be one, because the basic protein is going to the spike proteins alteration will be there. Still, it may work this vaccination, because the basic spike protein is added into the vaccine. So it's not going to be different from what we are facing now. As time goes, you know, even in influenza, there are A and B. There are 2 different types of virus. So as we go along, we are going to see that is a variation, and mutation is the survival
Of the virus.
virus.
Yeah.
So it will survive and it will come along with us. This vaccine will protect, basic protein is same. So even if the variants are there, this partly this virus, the vaccine is going to work. So you don't have to worry
Very.
about it. As time goes, we may have more things added to the vaccine, and we'll get variants also coming into the vaccine program. No, every year for the influenza virus, the new strains are added. So
Yes.
likewise, it may be added in future.
So yeah, so we have like a quadrivalent flu vaccine, which is covers 4 variants. So like that. So yes, definitely,
Similar
and
thing may
thi-
come across
across
the
and all.
coronavirus,
Yeah.
since it is a new. We are in the middle of the pandemic. So what is available, we should grab, and when it's heavily raining, when somebody is offering an umbrella, why not you take
Take
it?
it. Yeah. So the lot of hesitation in taking vaccine is also because of this so-called confusion between food allergy, drug allergy, vaccine allergy, sir.
No, this is again, no, it is reasonable to have doubts of it.
Doubts.
When it's up to us to clear the allergies. All allergies can be managed. Not that we cannot manage allergies. So I think there are enough treatment is available even if you get allergy. So allergy should not prevent you from taking
Yes.
vaccination.
Allergy does not mean that the medicine is not going to work in your body also. Allergy means that you're developing a very quick, fast hypersensitivity reaction in all these centers, nodal centers, corporation as well as private, have the medications to treat that type of allergy very rapidly. We have all the injectables loaded and kept. In the last 4 weeks, I have not had to use it for anybody. The maximum somebody has developed is a local rash, and it kind of just disappears in the next 10-15 minutes. Remember something, any of these rashes which appear, the more anxious you become, the more adrenaline you bring it out, the more the rash will spread. So don't panic, just go back to the doctor and they will sort it out also.
And as a protocol for all those people who are vaccinated, they are being observed for
30 minutes.
currently.
Yeah.
So any quick reaction should appear within 30 minutes. That is the reason for observing them for 30 minutes.
Yeah.
So it is quite safe to have a vaccination. Again.
Yes. So, and eligibility criteria as of now is only for anybody above 18-year-old, and they are going to open up to 60 plus public and those who have comorbidities. And when we say comorbidity, it is very, very specific. Those who have any type of cancer, who have renal failure, who are diabetic, who have had a heart attack. These are the people who are come into, or AIDS. Even HIV has not been restricted as a contraindication. They can take. What we don't know is how much antibody they are going to develop, or do they have what we call as energy. People who have simple hypertension, controlled diabetes, lipids, we don't need to panic, because you need to continue taking care of your primary issues whether you're vaccinated or not. So let us be very, very clear. So comorbidity as of now is for 60 plus people who have which can, if they develop COVID pneumonia, the outcome will be bad or outcome will be disastrous. That is the type of thought process which is going behind this criteria.
To add to your long list, the people with asthma and COPD,
Yes, so
chronic
lung
smoking,
diseases. Yes, absolutely.
they should also have a
Absolutely. Yeah,
vaccine.
they are also. Yes, I missed that. Yes. Yeah. So, who all should not take the vaccine, sir?
As you mentioned, no, below 18 years, and people who are lactating, people who are pregnant, they are not allowed. Currently, no enough data is not available. So the future recommendations will tell us whether to go ahead and vaccinate them also.
Yeah, lactating, there is a cutoff of 6 months.
6 months.
So that is there. And pregnant women, we do not give. But having said that, If any woman gets the vaccine and she realizes in the next 2 weeks that she's pregnant, there is nothing to
Nothing to
panic.
panic.
So we will observe the patient and the gynecologist will see. So far, none of these vaccines have found to have any type of deleterious effect on the baby. So let's not put the cart before the bull. So, yes. So, which COVID vaccine is the best? Which one have we taken, sir? We have.
There are two vaccines, as I told you in the introduction. There are two vaccines available. One is Covishield, and the other one is Covaxin. So I have taken Covishield. I think both the vaccines are equally effective, and the only difference is the Covishield has Covishield has gone through the three phases of
Yeah.
trial, whereas the Covaxin has gone through stage 2, and now currently the stage 3 experiment is going on. There are two different types of vaccines. Basically, one is live inactivated vaccine. Is the Covaxin vaccine. Covishield is the synthetic vaccine wherein the spike proteins are injected into your body and antibodies will be produced against the RNA particle of the virus. So they are both are equally effective, and I think India is one largest country which is producing vaccine for generations, and they have technology, and so much so they can supply to entire world. The entire world is looking forward to Indian vaccines, so you should remember that.
Yeah, absolutely. And it has been a very overwhelming goodwill gesture, the type of vaccine we've been sending out to so many countries. So we have a lot of questions from the public now. Why are they giving medicine? Not sure what medicine. Why are they not giving medicine? How is it? I don't know. The medicine, somebody has asked, why are they giving medicine? RNA virus vaccine is there, so why are they saying like pox herd immunity, same like it will go?
I didn't follow the
And I
question.
think somebody is trying to ask if, like in smallpox vaccination, we had vaccinated till a certain age, till a certain time, and once they realized that the cases are all down, we stopped smallpox vaccine, which is probably what meant by herd immunity.
Yeah, once we come to that stage, we are going to stop vaccination.
Yeah,
See,
but
that is how we have stopped.
Mm.
We are going into the similar stage into the polio vaccine. Now, slowly, when people develop herd immunity, we are going to stop. Then we have to declare that we are free of polio.
Yeah.
So likewise, we will come to one stage, then we will declare. Hopefully, we
It
do
will
that.
be declared, but I think it is too soon for that to happen, especially because we are still in the middle of pandemic now. The cases are increasing again, and we are definitely getting sicker cases. So I think this is not the time for us to throw the caution away. So when the vaccine has to be taken before getting affected by COVID, or it will work if it is injected to a person who is affected with COVID also.
There are two. One who had COVID, whether to vaccinate or not. Uh, you have a natural immunity when you get an infection, COVID infection.
Screen.
But that immunity is not going to last for long. Maybe it will stay for 3 months. After that, it is going to wane and disappear. So even if you have a COVID infection, after 3 months, you are advised to take a vaccine because it will boost up your immunity. So there is no contraindication for vaccination, even if you had a COVID. Only reason why you should not get vaccinated is if you have a what do you call active infection. You are in the
COVID.
process of having fever, you have a current infection, then you should not have vaccination at that point of time. Once you come out of it, 3 months have passed, then you can have a vaccination.
4 weeks to above 4 weeks. So if
After
you're
4 weeks.
COVID positive now, we wait for 4 weeks. After that, you can take the vaccine. We don't take the three contraindication, which is like right now, which is less than 18-year-old, pregnant women, and anybody who is sick or who has acute COVID infection, the government is not giving it to them. So why no quarantine? It's airborne disease. I think they are. Somebody is asking about why we don't quarantine if we have got vaccinated.
But there is no clear-cut recommendation as
Recommendation
of
as
now.
such.
No, in the beginning of our discussion, we said, quarantine is not required if your vaccination done after 3 months have passed. Then you don't have to quarantine. That is what
Absolutely, yeah,
said.
yeah.
So
So
I think we'll have to wait for
yeah.
more information.
Quarantine will also depend upon how close a contact it was from the positive person, and are you feeling the symptoms, whether you have faced somebody or not. If you are developing symptoms, it is better to get quarantine for your own benefit.
No, the vaccination doesn't mean that you are not going to follow all the precautions that you are following. You are going to follow, because vaccination should not prevent you from um, getting rid of mask or hand sanitization or social distancing. All that you have to follow, even if you are vaccinated, for some more time until we come out of this pandemic. This is going to stay for some more time. We are not out of the pandemic.
Absolutely, sir.
Maybe when it becomes endemic.
Yes, we are not in endemic, because there was a question about whether we need to follow the UK protocol and take the vaccine 12 weeks after the first shot. But that decides whether we are in endemic or pandemic. But because still in the middle of pandemic, we are taking the vaccine at 28 days. So if somebody has taken the first shot, it has happened to a lot of our doctors, and then they realize that they were COVID positive, they have to wait for 28 days from the time they have been detected positive, and then take the second shot. Somebody is asking whether there is life guarantee, sir.
It's a very good question. We should ask ourselves, leave alone the COVID situation. Is there any guarantee for anybody?
Absolutely.
There is no. We are traveling by plane. Is there a guarantee that we will reach the destination? You ask the airline people that they will give whether I'll reach the destination. Before getting into the train, if you are traveling, ask them whether they will give a guarantee that I will reach the destination. It is the same question that you are asking about vaccine. It's not fair.
It's not fair, yeah. And it always brings that idea that how people are vulnerable and how anxious they are. So
I understand that.
yeah. So, but
to make it clear, and we are here. In you need not have this kind of thoughts at all. Because we are in a grave situation wherein 150,000 people have died in India so far. So we are trying to come out of it. It's a tragic situation.
Correct.
So when something is available to overcome this,
we should take it.
And you can have doubts, but get it cleared. And
correct. The deaths have not only been the number, it has affected the way we handle our deaths. How our sentimental values are attached to it, and people who have survived out of this pandemic, 50% of them are still living with badly damaged lung, and their lives are restricted. They are going to be prone to picking up, they are going to be at risk to develop more and more other infections also. So I think taking the vaccine is as life-saving as it will go a long way. Somebody is asking whether we can vaccinate transplant recipients.
We can. Yes. There is no restriction. There will be difference between the response to the normal person and the transplant people, but it will work. The immunity may be slower and suboptimal sometimes. Maybe multiple vaccination may be required in future. That directions as we go along we will know. But right now there is no contraindication to stop vaccinating them. It is advisable to vaccinate.
So somebody wants an answer in Tamil. So நீங்க இப்ப தமிழ்ல கொள்ளணும். கோவிட் பாசிட்டிவா இருக்கிறவா கோவிட் வேக்சின் எடுத்தா அவளுக்கு கோவிட் ஏன் டோட்டலி அவளுக்கு கோவிட் வராம ஏன் இருக்காது? ஏன் வரும் திருப்பியும்?
கோவிட் இருக்கிறவங்க
கோவிட் சப்போஸ் அவளுக்கு யாருக்கும் கோவிட் வந்திருக்கு
இது வந்திருக்கு.
அண்ட் அதுக்கப்புறம் வேக்சின் எடுக்கிறாங்க. ஸோ கோவிடும் வந்தாச்சு, வேக்சினும் எடுத்தாச்சு, திருப்பியும் ஏன் தே ஆர் ஸ்டில் அட் ரிஸ்க் ஃபார் டெவலப்பிங் கோவிட்?
இந்த என்னன்னா இதுதான் நாங்கள் முதல்ல இங்கிலீஷில் சொல்லியிருந்தோம், வேரியன்ட் சொல்லிட்டு. இப்போ எடுத்திருக்கிற ஒரு வேரியண்ட்டோட நீங்கள் உங்களுக்கு இன்ஃபெக்ஷன் வந்திருக்குதுன்னு வச்சுக்கிங்களேன், இன்னொரு வாட்டி வர்றது செகண்ட் வேரியண்ட் டிஃப்ரெண்ட் வந்துடும். ஒரு தடவை ஒரு திருடன் உங்க வீட்டுக்கு வந்துட்டு போயிட்டான், இனிமே எந்த திருடனும் வரமாட்டான் அப்படின்னு சொல்லிட்டு நம்ம இருக்க முடியுமா? இன்னொரு திருடன் வந்தா என்ன பண்றது? ஸோ வேரியண்ட், வேரியண்ட்டுக்காண்டி வேக்சினேஷன் வந்து போட்டுக்கணும். ஸோ உங்களுக்கு புரிஞ்சதுன்னு நினைக்கிறேன்.
எஸ்,
சிம்பிளா அதை சொல்றேன்.
ஸோ கண்டிப்பா நம்ம வந்து நம்மளுக்கு கோவிட் இன்ஃபெக்ஷன் வர, அதனால வர அந்த பாதுகாப்பு ஆன்டிபாடிஸ் வந்து நம்ம உடம்புல நிறைய நாள் இருக்காது. ஒரு 3 மாசம் இல்லை 4 மாசம் வரலையும் தான் இருக்கும். அதுக்கப்புறமா வேக்சின் தான் பூஸ்டர் டோஸ். அதனால அந்த 2 ஷாட்ஸ்ல வந்து சென்சிடைசேஷன் டோஸ்ன்னு சொல்லுவோம். அதனால உங்களுக்கு கோவிட் இன்ஃபெக்ஷன் 2வது ட்ரிப்போ 1st ட்ரிப்போ வரைச்சி அதோட இன்டென்சிட்டி, அதோட வந்து உங்களுக்கு படுத்த அந்த ஃபீவர் வர, சிம்டம்ஸ் வர, அதெல்லாம் கம்மியாக வரும். அதுதான். ஸோ somebody has asked about what are the precautions for a pregnant woman on Covaxin. I don't think there is no question of precaution. We do not vaccinate pregnant women because studies are never done on pregnant women. So the safety itself is not established. So efficacy does not arise. We do not vaccinate, and Covaxin is still an open label trial going on. So there is no question of pregnant women getting the Covaxin. We've already, somebody has asked, can asthmatic take the vaccination? Definitely. Yes, definitely they have to take.
The reason being, the lungs are weak. So another damage to the asthmatic lung is going to produce severe disease. So definitely they are the high risk group people wherein we have to vaccinate them on priority basis.
So are there any immediate and long-term side effects? I don't think so, but we don't know.
No, the time only will answer. The immediate thing we have seen, we have vaccinated almost, it's going to come to an end for healthcare workers. So we haven't had any immediate reactions, something abnormal from other vaccines. So the kind of reactions that we used to get with the other vaccines like measles, mumps, rubella, and all other vaccines, we are getting with this also. Abnormally, we have not seen any major side effects.
So for people considering to become pregnant soon, or for people with underlying disease, or if they are planning for some elective surgeries, should they wait for the vaccine? No, they should not wait for the vaccine. They should definitely take it. The only time where you have to wait, okay, you're scheduled for a vaccine. We have had some patient came with a dog bite, and we have to prioritize the vaccine against the dog bite, for the dog bite, which we call as the anti-rabies vaccine. That is more important. So they need to take the anti-rabies vaccine first, finish the schedule, and then after 2 weeks of the last dose, they can go for the COVID vaccine. So anybody is going to do a travel, going for a surgery, planning pregnancy, definitely go ahead and take the vaccine. Even if, in spite of that, if you're going to, the swab testing is going to be done at different places as per the local laws and regulations.
I think, it's a priority. What is important, you have to do first. When a house is on fire, get out of the fire first.
Yes, absolutely. Yeah, we are on fire right now. So should you stop any ongoing medication before taking the vaccine?
No. You have to continue your regular medications and go ahead with your vaccinations. And I don't see any situation wherein we have to stop medication and take a vaccination.
No. So there was some discussion about the aspirin, blood thinners and all, and I think
blood thinners, if you are taking blood thinners, or you're not taking any other injection, what about insulin you are taking? There are a lot of people who are taking blood thinners are taking daily insulin injections and other injections, other vaccination, flu vaccination and all there we are giving. So So I don't think there is absolute contraindication for avoiding vaccination because of the blood thinners. And also people who have got valve implantations, the aortic valve or mitral valve, the prosthetic valve, if they are on warfarin or any anticoagulation, there is no absolute contraindication. At the most, we are going to get small swelling here that can be managed.
Yeah. So no
With the
no
appropriate treatment, it can be managed.
but no massage, no fomentation, maybe maximum a little icing. And if it is painful, meet your doctor, take a paracetamol or something like that. Don't do anything on your own. Yeah. So what are the general rules and restriction after the first and second dose of vaccine? There's nothing
Nothing. If you are
specific.
feeling feverish and tired, muscle pain, maybe one day rest will be suffice. I think even without medications, a lot of people have managed. And if you don't get reaction, also don't worry, because a lot of people worry about why I don't get a fever, I don't get any reaction. It is working, but don't get worried even if you don't get reaction.
So somebody is asking, along with other vaccination for the babies and children, what is the stand for them on Covaxin? Like we said, as of now, there is no permission, or we're not allowed to vaccinate anybody less than 18-year-old because the studies are going on. But if I am right, if I'm not wrong, we have not seen children less than 12 years being majorly affected by COVID pneumonia itself. So I think they will be exempt from this vaccine. 12 to 18 is what the study is going on, if I'm understanding correctly.
The nature of the disease is like this. It
Yeah.
affects more than the adults than the children. So currently the scientists, the government are advising not to vaccinate them.
Yeah.
We may have more clarity on this as we go along. We'll have to wait.
Can the cancer patient completed chemo and radiation therapy take the vaccine? 100%.
Yes.
Please, definitely they can. They can do that. Yeah, I think we are, yes. So we are also opening the vaccination for public from 1st March. We have our portal ready, and anybody who has a doubt, please feel free to messages or reach out to us on our portal. And we've been doing community work, in-house, inpatient, outpatient, flu clinic, home quarantine for the last 1.5 years. Anybody who has reached out to us under Dr. Swamikannu's mentorship, we have been doing this for the last 1.5, 2 years, and so far no regrets. Yes, we've had some bad outcomes, some good outcomes, some very good outcomes, and I think that's life.
Okay. Just to conclude, my worry is do not have too many doubts about vaccinations. Nobody wants to give you a vaccine that gives you trouble for you. We want to get you out of the trouble. So please do get vaccinated when your turn comes. Thank you.
Yes, please get vaccinated. Do not let any type of inhibition stop you. If you have a doubt regarding your personal condition, for example, somebody has asked stage 4 cancer and all, please check with your primary doctor. The doctor who is treating you will be able to tell you more basis whether you need to take or not.
No, you'll be able to.
They will be able to guide you better. And for anything else, we are always there. Yes, already told. Yes. Thank you very much.
Thank you.
Yeah, and please register and come forward. That link is there. Register with us for the public vaccination, and we're going to be open for public soon from 1st March. The protocol will be in place, and if there is any doubt, reach out to us. Thank you very much.